You're watching Health News. Good nutrition, which consists of an adequate, well-balanced diet combined with regular physical activity, is a cornerstone of good health. Without looking too far, poor nutrition, on the other hand, can lead to reduced immunity, increased susceptibility to disease, impaired physical and mental development, and reduced productivity. All this we want to guard against. Wondering how to achieve a well-rounded and balanced nutrition for you and your household? Let's hear from the President of the Nutrition Society of Nigeria, Professor Ngozi Nnam.
When we talk about nutrition, what we mean is we are looking at the food we eat, the nutrients contained in the food, and how these nutrients interact to make an individual be in a state of good health. So that's primarily what nutrition is all about.
Okay, so it's not about the quantity or the quality alone.
When you talk about quantity and quality, then that takes us to the quantity and quality of the nutrients contained in food. And that is what makes the person be in a state of good nutrition or to be in a state of malnutrition. And essentially why we are organizing this program with Unilever is to throw more light on what nutrition is all about and how people are expected to combine their food, the quantity to take, the quality of the nutrients, so that these nutrients can effectively interact with one another to put that person in a state of good nutrition and good health.
Why do you think nutrition is a major public health issue and, of course, issues of development in Nigeria? And what are the drivers of this malnutrition?
Of course, nutrition is a major public health issue that has to do with development. Like I have said earlier on, what nutrition is all about is about the food we eat and the nutrients that are present in the food and how these nutrients interact to make an individual be in a state of good health. So, you see, when we eat food, it's not just the food we eat, it is the nutrients that are contained in the food that are of importance. And we know these nutrients: protein, carbohydrate, fat, minerals, vitamins, and water. These nutrients are supposed to be taken in adequate amount to nourish the body. For example, for a growing child, the child needs all these nutrients for the brain to develop well. And it's only when the brain develops well that that individual will be able to contribute to his own, make significant contribution to national development. So nutrition will help that individual to develop well, both physically, mentally, and otherwise. And it's only well-developed individuals that can go to school, go through school successfully, get good education, get good job, and make their significant contribution to national development. So it's all about individual development and national development. And the nutrition is the key. It is the bedrock to these developments. It's adequate nutrition that will make the fetus to form and develop well. It's adequate nutrition that will enable the baby to grow to a full-fledged individual that will be able to make significant contribution to national development and to productivity. So it's a public health issue that has to do with individual and national development. And that's why Nutrition Society of Nigeria has decided to partner with Unilever to give series of nutrition education messages to Nigerian populace.
Okay, we'll come to that, but I'm just, as you're talking now, and as the president of the Nutrition Society of Nigeria, what's your assessment of the nutrition of an average Nigerian?
Many Nigerians are in poor nutritional status, particularly children. The current statistics have shown that up to 37% of children are stunted. And this means that they are too short for their age. And not just physical appearance. This being short for their age is also translated into development. They have stunted development, and this is what they are going to carry on into the nation. Then another 29% are underweight, and you have 18% wasted. And this shows high degree of malnutrition in Nigeria. Presently, the issue of overweight and obesity is crippling in, complicating the issue, leading to double burden of malnutrition with micronutrient deficiency. So many people in Nigeria are malnourished.
Okay, and what would you say is the driving force of this?
The major issue that leads to malnutrition is lack of nutrition education. People don't know what to eat, how to combine their food, what quantity to eat, and in what proportion to combine the different food ingredients to get an adequate diet to make them be in a state of adequate nutrition.
Sorry, give us an example. When you say people don't know how to know the adequate portion or proportion of the food that they eat.
You see, in the midst of plenty, people need to make informed choice of what to select, what to combine in a meal. This is the crux of the matter, because our health depends on what we eat.
So give us an example. I just want to, like, for instance, somebody may be eating rice with plantain.
Let me give you an example. I just want to lay the foundation to the example. Like I said, people are not making informed choice of food. For example, you see somebody combining rice and macaroni. I just wonder what the combination is going to lead to. Foods are classified into various groups. You have foods that will provide the body with carbohydrates. Then you have foods that will provide the body with protein. You have food that will provide the body with vitamins, with minerals. Then you have water, as these are main components, main substances, main nutrients in the food. And the secret of eating adequate diet is that when you prepare your meal, when you are picking food items that will form the component of a meal, one is expected to pick at least a food item from these different food nutrients that will supply these different food nutrients. And a clever way of doing this is using the food pyramid. This food pyramid has classified all foods into 5 major classes. And we know the picture of a pyramid is like this: wide at the base and tapers to the top. So the food at the base are those foods that are expected to supply energy to the body. They are your roots and your tubers, your cereals like cassava, yam, cocoyam, bread, pap. All these ones are carbohydrate-giving food. And because they are at the base, that shows you the proportion of the food you are going to have in a meal. Then just after that carbohydrate foods at the base, you have your fruits and vegetables. And the fruits and vegetables are the ones that will supply vitamins and minerals. We know examples of our fruits: oranges, mango, and vegetables.
If we follow the pyramid up there,
yes,
we are likely to have the balanced diet that we need.
Yes, I've not gotten to the top of the pyramid. Then you have the legumes just above that. Then the fats and oil. The key word in selecting food, in having adequate diet, is that you have to eat variety of food in moderation, proportionate to one another. And the pyramid gives you the proportion. As you taper, you are reducing on the quantity for each meal.
Now, let's talk about the partnership, collaboration between the Nutrition Society of Nigeria and Unilever.
Yes, it's because of this high incidence of malnutrition that Nutrition Society of Nigeria is partnering with organizations, agencies, like this partnership with Unilever to address nutrition issues in Nigeria. We know that Unilever has their education support, and they have used it for nutrition education to package together with Nutrition Society of Nigeria series of these lectures to throw more light on how people should eat, how they should package their food, combine their food to be in a state of good nutrition.
Okay, and you were talking about, I think, if we talk about nutrition, we'll talk about food that are well fortified.
Yes.
Okay, and that will help the children.
Yes.
Vitamin A issues and...
When we talk about nutrition, there are ways of improving the nutritional status of individuals. One is to eat adequate diets. And this adequate diet, like I have said, government is really interested in fortification. And fortification is a way of adding some of these micronutrients like vitamin A to improve nutrient quality and quantity. And Unilever, in some of their products, have really cashed in on this. Okay. Their Blue Band margarine is fortified with most of these micronutrients, vitamin A, folic acid. Okay.
Thank you so much for your time. Thank you for coming.
Thank you so much. Thank you.